before we move to the Q&A, I'll just take a minute to reflect on what we just heard from these 4 very different speakers. For me, it's always fascinating to see the diversity of a perspective and the diversity of what the brain is about. And so I thought, we really had some incredible insights from concussion in youth to genetic testing, heart-brain connection, neonatal brain healing. You really offered a glance, a first sight of that complexity of the brain. And so I'm pretty sure we'll have some very interesting questions from the audience. But before we start with all of you, so hold your question, think about your question. I'll start with something we have not prepared. That was inspired to me by my Uber driver, who asked me that question. He was wondering why I was coming to the Grande Bibliothèque, and I explained what we are doing this afternoon. He said, if you had to summarize what your knowledge or what's interesting for you or your perspective of the brain in one word, what would it be? And since you have such different perspective, if you had to describe to somebody who's not necessarily familiar with the brain in one word, why would it be, and why? Yeah. So, trick question, they're not words, it's really like...
Mine is plastic. Mm-hmm. Because I think there is so much thing in the brain that you can influence when they are baby or even adult, or even, getting old. Mm-hmm. So it would be plastic.
Plastic. Roger?
Reintegration.
Wow.
I think for concussion, we learned that it doesn't really matter what we call it anymore. A lot of people will have symptoms that last a long time. And one of the lessons I tell my patients is we can call it concussion, we can call it persisting symptoms, we can call it PTSD, you can have lots of these things, but you got to live your best life. And that's you getting back to doing, to whatever degree you can, the things that you need and love to do. And that's reintegrating. And we show that's actually, evidence shows you get better with it.
Wow. I was going to say amazing, but then that's what this is called. So, but then I thought in my head, I'm thinking it's like the universe, right? There's so much we don't know about our brains, so much. And understanding the way it works, what we can do, how we can heal it, we still don't know so much. So I think it's almost like the universe, right? It's open and it's endless what we can learn and the knowledge that we have. So, whether we're speaking traditionally or we're speaking about science, but a lot of science is traditional, there's just so much we don't know.
My word would be now. And I think that it relates in terms of my presentation to the fact that so many youth that we see have been ill for 2 years from their psychiatric illnesses before they come forward. And also because so many people dismiss the importance of heart health until 20 or 30 years later. Now's the time to make a difference in 30 years, not in 25 years. And I think it sounds like it's true also for concussion and for lived experience integration and for intervening with neonates.
So long-term consequences, I guess you can become a physician and study concussion, and I'll give a talk here today. I've had 3 myself, so that's probably the reason. You need to study things that you're passionate about. So in all seriousness, though, beyond my own story, there are people who, we expect people with concussion to get better, and it's starting with the right treatment at the right time. With regards to that, I do think it is important to recognize that with regards to, there are some people, like I said, that I use the analogy for my patients. We've all gone camping and we make our little campfire and we have our s'mores, and you put out that fire and it's out, or at least it's mostly out. You let that fire burn, be it the analogy similar to what we learned about mental health. If you keep that fire burning, it's now moved from the campfire to the bush to the tree to the forest, and now the whole forest is on fire. It's the same fire, it's just a lot harder to put out. And so that's where I think that importance of early treatment is better. With regards to the long-term consequences, we're still learning that. We do know that there's mental health implications, there's other long-term risks of addiction and other problems, and so that's why I'm passionate about treating concussion early. I'm also passionate about doing the things we could do to prevent the concussion from even happening. So be that through rule changes in sports or better equipment or better policies, and that's the best way to treat it is not let it happen.
Yeah, thank you. So for the second part is, yes, we're taking good notes of migraine as something we could bring to the fourth amazing brain, but I will change the question. Do you think there's enough research happening in migraine here in the country right now or globally? And you might not be experts, I acknowledge that, but you have peers and you have, so I'm just kind of changing a bit the question.
I could talk about it as somebody who suffers from migraines, especially during sort of that perimenopause and menopausal time in life. And a lot of doctors don't know about migraines, and then there's a treatment, Botox. Like there's a couple of novel treatments, but they're not necessarily recognized by our benefits providers, so it's an out-of-pocket expense for these things, and a lot of people don't talk about migraines and how debilitating they can be. So I think it's great. I saw, which actually sort of lends to a lot of the stuff we're talking about up here, research recently about they took imaging of women's brains when they were having these bad migraines, and the brain heated up. So what are those long-term effects of going untreated for migraines, and that on mental health, on depression, on our heart health, we just don't study that yet, and I think it's a really important area.
Anything we'd like to add? No?
I would just add, so we looked at headache in youth with bipolar disorder and found that regular headaches are not elevated in youth with bipolar disorder, but migraines are over 5 times higher. And my belief is that this is part of the intersection between female sex, vascular, and brain. So they're questions of fundamental importance.
I agree. And I can tell you that we're also a funder of research, and it's something we have very much in the top of our mind. So.
Short answer, yes. We've done studies. I'm an emergency physician. We've done studies in the emergency department where we give kids just the instructions with a little picture of how they feel, and they base it on how they feel. And that study has shown that the kids who follow that self-guided exercise plan, even without wiring them up, do just as well. I do hope that we get funding to do research to send people home with, a lot of people now have abilities to check heart rates very easily based on a watch or a simple chest strap or even a wristband can measure the heart rate. And my colleague, Dr. Letty, got funding from the Department of Defense, recognizing that a lot of people in the field can't do those tests, so they did a march in place. So you can even just with a wearable device, march in place, get your heart rate up that way, and it makes it pragmatic for anyone, anywhere. And that's my goal, to make it available and accessible for all. So I'll let you answer your part of your...
And there's a couple of angles. So one is a decade ago now, we published a paper in the leading journal of the American Heart Association that established that bipolar disorder and major depression in youth are independent risk factors for heart disease. And I thought that would kind of change the world, and it hasn't as much as I would have hoped. And so I think that it's going to require people and families being aware of this information and self-advocating. Because as I mentioned, stigma, I don't use that word lightly or flippantly. I do think that there's different approaches that people take to these illnesses. And the fact that something like rheumatoid arthritis in a youth could cause heart disease, but bipolar disorder can't, I can't get my head around why those would be different. One of the things that we've done actually with support of Brain Canada was to look at personalized exercise interventions. So people say, do you prescribe exercise? And I don't, because writing something down that doesn't tell you about the person's fitness, that doesn't tell you about their preferences, that doesn't tell you about how much distress they have from a short exercise session versus a long one, is not going to hit the spot, and there's just too many barriers. So I think that one of the things that can be done at a societal level is do a better job of personalizing these interventions so people have a chance.
I think the idea comes from there, because there is study going on for adult stroke, Alzheimer, and multiple sclerosis, where they show some advantages. It may be not as efficient as in a baby, because a baby, the brain is maturing, and as we get older, our brain is not so much maturing anymore. But yes, there may be benefit.
Thank you very much.
And so just to rebound on that, what should be your next step with the research you're doing right now to become closer to clinical translation? You alluded a bit to that. But
yeah, now we are in the phase 2 trial to extend in Canada and in United States. We want to enroll 120 babies. We are at 21 or 17. And so we have a few to go to prove this. We have finished the part in Uganda, and hopefully we can extend that also after.
It's a fantastic observation because a lot of the people with COVID also have autonomic dysregulation. As one of the co-presenters, co-sponsors of this talk today is the Brain-Heart Interconnectome Research Study, and I'm a scientist at that, and we are doing tests of autonomic dysregulation. It's called a tilt table. So people lie down, and then the table itself, it's kind of like a carnival ride. It kind of stands them up kind of quickly, and it sometimes can bring on symptoms, make them dizzy, make them lightheaded. Their heart rate can change. Their beat to beat of their heart can change, and it can bring on a lot of their headache and symptoms. We know that people with COVID will have this as well, and so I would absolutely think that the treatment could be very similar, and it's again that finding that Goldilocks zone. And what's hard is, a person normally can go for a run, and what we say is your maximum heart rate that you normally can be is 220 minus your age. So if you're a 20-year-old, you may be able to tolerate a 200 heart rate. Well, if that kid suddenly gets symptoms at 110, they're basically only doing a brisk walk. And so it's just building it up slowly over time back to retrain that autonomic nervous system dysregulation. So I do agree with you that that's certainly a possibility.
Yeah, so with juvenile diabetes, there's not that much, but I think that the overlap between diabetes and bipolar is relevant in terms of treatments that can be used for them. I would say that a difference is that microvessel problems in diabetes are generally thought to be an end result of how well the disease is controlled, whereas the way we're framing bipolar is that this is part of the cause of the disease. But either way, I think from an intervention perspective, from a lifestyle perspective, the same messages are going to be true, and it's going to be true for migraine as well and epilepsy as well.
Yeah, so I think you mentioned in adult, it's tested in other things. One of the part of the talk I find interesting was the retina, because actually in our lab model we show that the animal that has HIE, have a reduced eye on the side of the things. And so then we decided to study the eyes in addition of the brain, and we find that they lose the kind of brain cell in the retina. So there is all a layer of the retina that they lose. So then we try to translate that in human, but it's hard to see the retina, so we haven't found yet a way to measure it. But the sildenafil improved that part also in the lab model. So we would be curious to see if you can measure it also in human babies. So I think it is interesting that despite the age, the same method may apply, a different way.
There is not a single disease that exists for which exercise isn't beneficial. It's beneficial for back pain, it's beneficial for heart disease, it's beneficial for stroke, which is severe traumatic brain injury. It's every musculoskeletal injury we have. So exercise is probably better than any medicine that any of us will ever discover, and I think that's the case. The analogy I give to people who are afraid for concussion to get back to doing what they're doing, I say, think of it like a sprained ankle. If you never took a never step again because it just hurt a little bit or it hurt a little bit every time, you would never walk again. But we know with the sprained ankle, you got to get moving, and it's the same for exercise or your wrist or shoulder or any other disease. So.
Yep. So I think the second part about the implications, time will tell. I think we're not there at that point yet, but I think if there's something that's going to be widely available to people that could make a difference in terms of a quick snapshot of brain vascular health, this is a high candidate. And in terms of your question of whether it's qualitative, no, it's quantitative. So far, we've really focused on vessels, but there's been advances in technology that allow you with one device to look at vessels and the retina and its different layers. So as you heard from Dr. Wintermark earlier, then there's different layers of the retina, and those can be quantified. And so we're also interested in, and we haven't done this yet, look within the retina, the relationship between vessels and nerve. So all of this is done quantified, and it's really easy to measure. Because of the advances in ophthalmology, all of this has been led by industry, and so the devices that do it are extremely reliable. You don't have to kind of build your own version, so I think this research is really promising.
Thank you, everyone. It's time for a short intermission. So I propose we all come back to 2:30. And yes, please, let's thank all of our speakers.